Good afternoon, everyone. My name is Brittany Miller, and I'm really excited to be back for our Facebook Live series, Here with Families, Here for Families. We really hope everyone had a wonderful holiday vacation. I know it's been a while since we've had a Facebook Live series, and I'm super excited for today's topic because it's very important that we inform ourselves and get the facts from accurate sources about the COVID-19 vaccination. Before I get into our topic for today, I just want to welcome everyone again for jumping on. Again, my name is Brittany, and I've had the privilege of hosting this series since we started the pandemic, and Raising Special Kids really shifted our support and outreach virtually, as we know many of you have gotten used to as you've worked from home, as your children have distance learned this almost year now. But we want our families to know that we're thinking of you and that Raising Special Kids is here to support you during this pandemic. So please know that we're here if you have any questions or need assistance. As a way of an update for our organization, we're just getting back to helping families, talking about IEPs and special education as children are back in school, even virtually. We do want to say a very, very giant thank you for those that supported us in our annual campaign this year. It was really heartwarming for all of us to feel supported and know that people in the community love our mission at Raising Special Kids, donated, supported us so that we could meet our goals. So thank you so much for remembering us, and stay tuned because we will be announcing our tax credit campaign. So if you didn't get to donate yet, don't worry, you can still support the work we do in helping families raising children with disabilities. So thank you. Another announcement I wanted to share too is we are going to be changing our Facebook Live schedule slightly. So I'm going to be here every other Friday doing our Here with Families, Here for Families series at 1, just like we always have. And then on the opposite weeks, we are going to have our Spanish Facebook Lives. So we're all going to be on Fridays and we're going to shift back and forth. We may do a few special, sessions during the week if we have guests or things like that. But just remember to mark your calendars for every Friday at 1 because we will be here to update you and inform you as best we can on all these different important topics. Okay, so today we're going to be talking about facts and information we need to know as parents, as individuals, about the COVID-19 vaccination. Before we get started, I just want to give the disclaimer that we are not medical professionals at Raising Special Kids. I'm not a nurse or a doctor, although raising a daughter with medically complex issues, maybe I feel that way sometimes. But in all seriousness, the information we're sharing is literally directly from the CDC website, and we're not going to be sharing any scientific information about how the vaccine works or talking about the vaccine in ways that we're not qualified to do. So we're just going to be giving you information about things you need to know from the CDC, who gets vaccinated first, and kind of going over that schedule, and then just ways we can still keep each other safe as we know our numbers are really high in Arizona. So moving forward, I'm going to be reviewing with you all 8 things that the CDC would like us to know about the vaccine. And I wanted to make sure that we are sharing accurate information. So I'm literally going to be reading from their list. It's super friendly, parent friendly, and helpful. And if those of you saying hi in the comments, thank you. I'm so glad I have listeners listening in to this important topic. And if you want to share this with your friends and neighbors. These videos, just so you're aware, they live in our Facebook video section and on our timeline forever. We also upload them to our website and the Raising Special Kids YouTube channel. So share this information because it's going to be important for families to know where to look for information about this vaccine. So number 1, the CDC would like us to know that the safety of the COVID-19 vaccine is a top priority. The U.S. vaccine system ensures that all vaccines are as safe as possible. And they have created this new tool called VSafe, and it's using safety monitoring through actually a smartphone-based app, which we're all very familiar with. And it's kind of acts as a health checker for people who receive COVID vaccines. So the CDC has put in these safety measures. Our U.S. vaccine safety system, is making sure they're following them. If you have any additional questions about that, please go to the CDC's website, and we are going to put that in the comments. It's a treasure trove of information about the pandemic and all of these things we need to know. Number 2, The COVID-19 vaccination will help protect you from getting COVID-19. Something to remember that I learned is 2 doses are needed. 2 doses are needed. So when it's your turn or when the vaccine becomes available for more of us in the public, you will need a second shot 3 to 4 weeks after you get the first dose. Again, talk to your primary care physician if you have questions, but that's important. And as if you choose to do the vaccine, just ask your professional any detailed questions about any side effects you may feel afterward that are pretty normal, anything like that. But the CDC wants to let the public know that there has been a lot of science, really preemptively at the beginning of the pandemic. A lot of funding was put into, I was reading into developing this vaccine. So even though it seems like it's come out rather quickly, they've been working on this for a while. And that gave me really peace of mind as a mom, as a parent, as being around people in my life that have, conditions that may be more prone to COVID. I have a medically fragile daughter. It just gives me some more peace of mind to know that there has been a lot of research that has gone into developing this. Number 3, the CDC is making recommendations for who should be offered the COVID-19 vaccination first, because we know right now there is not enough for everybody. And I'm going to go over briefly who will get the vaccines and why. The first group of people are people that work in healthcare and long-term facility residents. And I think it's pretty obvious as to why they would get the first dose. They work with the public, they themselves may be vulnerable, and it's a priority for them to be vaccinated. The next phase 1B, is for frontline essential workers. So firefighters, police, the Postal Service, teachers, and people aged 75 years or older. And I'm reading this directly from the CDC site. Phase 1C is for people aged 65 to 74. And then after that, people 16 to 64 with underlying medical conditions. And then other essential workers that work in transportation, food service, public health, and safety. And I'm assuming at that point, we'll have more information about how we eventually will be able to access this vaccine by making a doctor's appointment and getting our shots like we would with any other. And I wanted to share a comment too. Thank you, Neil. One of my teammates at Raising Official Kids shared that he had his first dose and he said no side effects other than a sore arm for a couple of days. And it was really easy. And that is good to know. Thank you for sharing that. I just did my pre-screening because I am in the priority group. And it was really easy. So if you end up being the person that meets one of these criteria, they'll give you information to go to a website, you'll fill out a pre-screening form, and then they'll email you when it's time to schedule. So it was a lot less intimidating than I thought it might be. And it's giving me a lot of peace of mind hearing many people, some of my daughter's therapists, her nurse, my coworkers, people that have got the vaccine and have shared their experience so far. Okay. Let's see here. Number 4, there is currently a limited supply of COVID-19 vaccine in the United States, but supply will increase in the weeks and months to come. So they are working on it. I'm sure these scientists and people that develop this vaccine are working nonstop, 24 hours a day to get as much of it out to the public. The goal, it says here, the goal is for everyone to be able to get easily vaccinated against COVID-19 as soon as large enough quantities are available. So in the coming months, I'm sure there'll be more information from the Arizona Department of Health Services, the CDC, our government leaders. More and more vaccine is going to be available for those that choose to get it. Number 5, after COVID-19 vaccination, you may have some side effects. And I kind of mentioned that. It's a normal sign that your body is building protection. And they shared that the side effects from this vaccine may feel kind of like the flu, or you may have a sore arm, or a headache, but that's normal according to the guidance here from the CDC, and it should go away in a few days. And if you have additional questions or have an issue, of course, please contact your doctor or your medical professional. We have a question here. Let's see. I don't know if I'm qualified to answer, but I do know Wendy. She asked if the vaccine is mandatory or optional. And it's my understanding that it's optional. We have the choice to inform ourselves and decide if we want to take the vaccine. Providers need to take the vaccine. Again, I'm not qualified to tell you you have to, but I do know that many of our providers that work with our children with disabilities, so maybe respite or HAB or things like that, have been able to be part of one of the priority groups so they can make that choice for themselves. And again, please ask your doctor if you have questions. Go to these websites. They are very much informed and about safety and the medical science behind it. We're just trying to share updates for our community so they can be informed. Okay, let's see. A disclaimer they wanted to share too is a lot of people may ask, can getting a COVID-19 vaccine make me sick with COVID-19? No. The CDC shares that none of the COVID-19 vaccines contain the live virus that causes COVID-19, so the vaccine cannot make you sick with COVID-19. So that is really good to know. Okay, I'm going to pull this list up to the next one, number 6. Let me just make sure there's no more questions. Thank you. Okay, cost is not an obstacle in getting vaccinated against COVID-19, and that is wonderful. So vaccine doses purchased with US taxpayer dollars will be available for the American people. However, it does say the vaccination providers, they may charge, they may have the option if they choose to charge like an admin fee, but vaccination providers can get this fee reimbursed by the insurance company. So if that's an issue, ask your doctor when it gets to that point and the vaccine's available. But the whole goal really is what I'm reading is that they want this vaccine to be available for all of us that want to get it and not have it be a financial, something we couldn't afford, make it available for everyone. Number 7, the first COVID-19 vaccines are being used under emergency use authorizations. It's the EUA from the US Food and Drug Administration. Many other vaccines are still being developed. So as more vaccines come out, they share that if more COVID-19 vaccines are authorized or approved by the FDA, they have advisory committees on immunization practices that will hold public meetings to review all the available data about each vaccine and make recommendations for their use in the United States. So as you can imagine, it sounds like many companies, scientists are working on vaccines because we're in a pandemic. And stay tuned, follow these websites, register for the Arizona Department of Health Services emails, follow the CDC on social media. They have a lot of good information. It'll help you make an informed decision. Number 8, COVID-19 vaccines are one of many important tools to help us stop this pandemic. And I think this was important even for myself to remind me, if you choose to get the vaccine, you still need to mask, wash your hands, social distance, do all the things we've been guided to do over the last, 9 to 10 months. It's important for everyone to continue using all the tools available to help stop this pandemic as we learn more about the COVID-19 vaccines and how they work in real world conditions. So if you get it today, still mask up, still do what you've been doing to protect your loved ones in our community. Cover your mouth and nose with a mask when around others. Social distance, avoid crowds, and wash your hands. And the CDC does share that they will regularly update this site and this list of things we need to know as vaccine recommendations come and the supply changes. So those were 8 really important facts that we wanted to make sure our community knows about. And I did talk about, the different groups and why, and I think it's pretty, understanding and self-explanatory about how the vaccine is being released. So moving forward, I'm going to share some other important reasons why it's important to get the COVID vaccine directly from the CDC. So that way you can make a decision for yourself and for your family. It will keep you safe from getting the virus. Vaccination is a safer way to help build protection and immunity. Getting the vaccine and having it work effectively is a 2-dose process. Don't skip the second, and we talked about that briefly. COVID-19 vaccination will be an important tool to help stop this pandemic. Wearing masks and social distancing help reduce your chance of being exposed to the virus or spreading it to others, but these measures are not enough. Vaccines will work with your immune system, so it will be ready to fight the virus if you are exposed. The combination of getting vaccinated and following the CDC's recommendations to protect yourself and others will offer the best protection against COVID-19. And again, I'm reading directly from the guidance from the CDC website, so all of you can have this information. They also say stopping a pandemic requires using all the tools we have available. As experts learn more about how the COVID-19 vaccination may help reduce spread of the disease in communities, The CDC will continue to update their recommendations. This was super helpful for me. I know many of our families that we support at Raising Special Kids have people in their life that are vulnerable, that are medically fragile, that are more prone to get COVID-19. And it's helpful as I've reviewed this information to share with our community today. It's helped informing me so I can make that decision along with my husband for our family. So again, we're not giving you medical advice. We just at Raising Special Kids want to make sure that our community has the resources to go to that are accurate, that will give information that our families can use as tools to educate themselves. So please check them out. Check out the Department of Health. Follow the updates from the CDC so you'll know how to best make decisions for your family. And in closing, we just want our community to know that we're thinking of you. We know this is a really difficult time, and we've been in this for 9 to 10 months. And I know it's affected your family, it's affected my family, and all of us at Raising Special Kids are in it with you. You know, we're all in this together. But as we move forward into 2021, we're still here for you. We're going to be doing our best to provide information to our community, to give some peace and comfort and even solidarity as we get through this trying time of this pandemic. But I'm hopeful as the vaccine is now released and people, if they decide to get it, I'm hopeful we'll see some progress and some relief from this pandemic that has hit our society. And with that, we're thinking of you. Have a wonderful weekend, and we'll see you next time. Bye, guys.